Before we roll call, is there anything that needs to be on the agenda or changed on the agenda? The comments on the agenda?
Mr. Chairman,
Yeah,
I would like to make an addition to the agenda, after the roll call, prior to public comments, that we add an location, please.
okay. Right after roll call? Okay. Anything else? All right. Melanie, roll call?
Commissioner Ruby,
Here.
Commissioner Mapes,
Here,
Commissioner Turnbull,
good morning, President.
Commissioner Chamberlain.
Here.
Next, we have education. Commissioner Turnbull, you want to do it or?
Yes, sir.
Okay.
Heavenly Father, thank you for this opportunity to come before you to represent the people that we represent, to make decisions to better impact our community. I pray, Lord, that you give us clear heads and quiet our hearts, Lord, as we make these decisions. Help us to listen to each other and remember your teachings where you told us not to repay wrong for wrong, but instead be good to each other for everyone. I pray we can look to this teaching. We thank you for all that you do. And please bless everyone here and bless the committee and bless the health department. In the Lord's name we pray. Amen.
All right, next on our agenda, we have public comment. The guidelines are on the front. You have 3 minutes. I do have a sign-in sheet, but anyone who likes to speak is allowed to speak. So I'll go over the sheet first, I guess. I have Bob Wiley first.
Hi, I'm Bob Wiley from Emmett County, and like to try to determine what our purpose is. And I think everybody at this meeting wants some of the same things, and that is to protect our community and to do what's right. And I think there's some issues, of course, that we have different thoughts on what's right. But I think most of us agree that there's problems that have occurred imposed upon us from the state and from the national sources that have closed our schools sometimes, have made us wear masks, has closed our businesses, closed our churches. And we didn't vote for that. And we didn't like it. Caused us to be vaccinated, caused our kids to be vaccinated. When I'm a physician, there was no medical reason that children should be vaccinated under the age of 18. None, zero. Why did that happen? It was forced upon us. And I think that sometimes these grants and the things that come down that look good, be careful what's behind it. Be careful who really sponsored that money and where it came from and why, and are they trying to take power away from our community and take away our individual ability to take care of ourselves. And I think if you look at every grant and say, will this improve the ability of our community to take care of itself, or will we get more dependent upon a government, either state or national, or some organization like Blue Cross or Blue Shield or pharmaceutical companies? Will it make us more dependent upon what they're trying to do to us? And if we look at these grants with that in mind, and the realization that, hey, maybe there is no free money, there's something behind it. And I think one of the things on the discussion today is whether you should just look at the current new grants, or should you have the ability to look at grants that have been in position for a long time and just rubber stamp them and say, I will keep it going. Because they may not have been reviewed for 5, 10, maybe even 20 years, and they just keep going. And maybe it's time to review some of those too. Thank you.
Thank you. Next, I have Mark Ravicki.
Sorry, I never know what to say, and I, like Jared knows what this is like, 'cause I don't have anything written down, because I can't. But one of the things I'd like to approach is that grants are like crack. They're like a drug. Once you start, you can't stop. You get so dependent on these things and so hung up that you just can't stop. And we need to stop. And why do we need to stop? Because at some point, this thing is gonna fall apart. We see happening to our country while our country's falling apart. And many of these grants are designed by grantor organizations that are built to take us down, to take our government apart, to kill us. You know, the scariest 9 words in English language. We're from the government and we're here to help. No, we're here from the government and you better run. Because we're gonna do something you don't like. So, to make a long story short, I think the best thing to do is to turn the spigot off. Stop doing grants altogether at some point. Turn them off, slow them down. The older they are, the easier they are to stop them. You'll be doing everybody a favor in the end. You'll take this bureaucratic organization of the health department. You'll help get it back under control. You'll take away things that are being used right now against us by weaponizing it and saying it's for the children when it's really not. That's a thing they can beat us over the head with because it's always for the children. And sorry, but 9 times out of 10, there's a whole lot more than that. So we need to get away from this free drug money. We need to get away from these drugs. All these things they stick on us in these grants and what they require, it can be just ridiculous. These organizations that sponsor these grants, you gotta look at them too. Crooked, they launder money, and their sole purpose is to make themselves rich at your expense. While you think you're doing well, and you think that you're doing somebody good, and you think you're helping somebody, when in reality, you're just tearing it all down. Thank you.
Next, I have Laura Ford.
I'm a relatively new resident of Charlevoix area, moved us here from the Kalamazoo area. I am speaking today because I want to be involved in the health department and in my new community. I have a PhD in health. I teach health policy and law at the university level. I have taught at the University of Michigan, Michigan State University, Fair State University, and currently am on faculty at Western Michigan University. So I know of what I speak. I'm beginning to be involved in this community, and in part, I am speaking today because of my concerns, and also to speak to the Public Health Department about my support for their endeavors. I also was a nurse practitioner for over 40 years and very significantly invested in my patients' preventive care and when I worked in primary health. I want to hold the commission accountable for the decisions that they make. I believe in evidence-based practice. I have a PhD. I understand how facts can help guide practice. There's a difference between opinion and evidence. Giving funding to programs that will provide preventive health care can only serve to help the youth in this area, can only serve to help the community. There is no evidence that giving funding for preventive health programs removes parental control. There is no evidence that providing an alternative payment for dental care, for example, that is going to take away any parental control that there is. And preventive health practices are known, if they are established with our children, that they will continue to lead a life that focuses on disease prevention. So I'm encouraging you to consider that the grant funding is an alternative source of funding to help start some preventive health measures for our youth. Thanks for your time.
Thank you. That's the last person on my list, but anyone else who would like to give public comment? Yes, ma'am.
My name is Linda Travis. I'm from Elk Rapids. And I thank you for the opportunity to address you. And I wanted to point out in reviewing the last, I'm very supportive of the health board. I'm going to tell you a personal story why, and then I'll back to what I wanted to discuss. As a 10, 11, 12-year-old, I was fortunate to get the polio vaccine a long time ago, 1955. So you know I've got some years on. But I was very fortunate because the week before that vaccine was available, I was exposed to a friend. We played on the playground. She died from the polio. In college, one of my dear friends, which I met at Michigan State, she was stricken with polio. I met her at Michigan State, and she was stricken, and she has been a lifelong person. She was paralyzed from the lower chest down, so she has been in leg arms and crutches. She didn't get that vaccine, but she didn't get it, not because her parents didn't give it to her. She was just stricken earlier before it was available. So I'm very supportive of the vaccines that have taken our children from all of these childhood diseases that made them lose their hearing and all kinds of things. Measles, mumps, all that rubella, all of that stuff is kind of gone. And polio, thanks to the Gates, is almost eradicated from the planet. They worked on the African continent, Bill and Melissa Gates, trying to get polio wiped off the map. Thank goodness. Looking at your last board meeting, looking at the fact in reviewing that meeting, I think it was a non-meeting. If you go back and look at it, you had a little bit of opening, and you had 2 motions made. That was all that occurred. Nobody seconded the motion. Now, you don't have to vote for something after you second a motion. The motion gets it on the floor so intelligent people can discuss it. And there were 2 grants that were available that were both beneficial to kids. And I just challenge the fact that you can't, one of you even step forward and second that motion so that people that are knowledgeable can discuss it, and you can say, well, we're going to vote for it because of this, or we're going to not vote for it because of this. But when you just block it out, that's ridiculous. And that shows some collusion behind the scenes, that people behind the scenes were maybe illegally meeting or illegally discussing what they were and weren't going to vote for. And that's not what is supposed to happen
Ma'am,
in a public meeting.
ma'am,
Yes.
your time is up.
Okay, I made my discussion. Get the grants on the floor, discuss them, and help our children. Nobody is trying to suppress it.
Anyone else like to address? Yes, ma'am.
My name is Leanne McKinney. I'm a resident of Milton Township. And I find it very sad that there seems to be a lot of fear in this room and on this board. I heard in the invocation today that we want to come together to better the impact in our community. And I would agree with that. The grants that have been suggested, that have been turned down, have all been for the betterment of our community. I also have heard in the past, the Bible teaches us to be self-sustained. The Bible also teaches us to do unto others as we would have them do unto us. It also implores us to take care of the widows, the children. There are many other places in the Bible that could be quoted. We don't, any of us, come here without taking taxpayers' dollars. If you drove here on a road, you took taxpayers' dollars. People who are on Medicare take taxpayers' dollars. Farmers who take milk subsidies or get loans for things on their farm, and I don't object to that. And I'm willing to pay tax dollars to do those things. I hear a fear of science and a fear of education in this room. Now, I have a degree, but I have respect for people who don't have degrees. But I challenge you to listen to people who do have an education. There's certainly nothing that would cause you to fear. And to go into research and look at what's good for our communities, to look at what's good for the people in our area. Do not allow the elected people on the board to discuss all of these grants, I think is a serious flaw. Those people were elected as you were, and they have a right to discuss the grants and to come together and find solutions to some of the problems. Both of the issues that we have talked about for children, fresh food, fresh fruit, education on how to eat a good diet, which is going to affect their lives for the rest of their time on earth. Those things are important. And those things, the grant money that would come to us for those things will go to somebody else. They're not going to die someplace. Why are we so afraid to look at the issues and give up our fear of everything? Government, science, education. And I thank you for your time.
Thank you. Anyone else like to address the board?
Mary Lieberman, Emmett County. I have a couple different issues I'd like to address. One, if all resulting from this committee. The July meeting that you had a discussion and procedure for your grant policy and review that was to be taken to the full board at that first meeting in August. We got to that meeting, I attended that meeting by the way. There were no concerns, no questions, no amendments suggested or anything else. And when we got to that board meeting, the whole rug was pulled out from under this committee. One member of your committee decided to put his own version on the table instead with amendments. That's grossly inappropriate. It's disrespectful to this committee to have been blindsided like that. That's one issue. The other issue is what transpired at your last program and evaluation committee. I was not able to attend it, but I've actually, as hard as it is, I've listened to it probably 3 or 4 times. Some of the comments that were made in that meeting were so grossly offensive to your citizenship, especially the racist comments. And I was gravely concerned, and I understand why maybe no one did, but in the future, when such comments are made, that someone from this committee or the full board, if it happens there, will step up and object and put. Again, we represent all citizens, not just the ones in our own church and circles. Thank you.
Anyone else like to address? Yes.
Good morning. Before my minute starts, I would like to request a secular invocation, as is my legal right. At what point in the meeting is that preferred?
The agenda's already been approved, so you may request something for the next meeting, but this agenda's already been approved.
I did not see prayer on there. At what point?
I don't know if you were not here earlier, but one of the commissioners asked to have it added to the agenda at the beginning of the meeting. That's
No,
what-
I wasn't here.
Okay.
I was stuck at the break. So I'm understanding I'm not allowed to have a secular invocation.
I did not say that. I said that this agenda has already been approved.
Okay. I can do it.
You
Well,
may,
in my 3 minutes.
you may say whatever you want here.
In my 3 minutes then, I would like to start out by saying. Jesus Christ, you guys, Jesus Christ gave to the poorest. He fed the hungriest. He cared for the sickest. And if you're going to continue to use his name and act in the opposite, you're just swearing. And nobody called that socialism. I don't know one Christian who calls that socialism. In fact, when I analyze our government and where parallels exist, probably farming subsidies closest match that, but as a vegetarian, I am so grateful for farmers. But I keep hearing this prayer. And it says that we're doing this in the Lord's name. No. Not when everything contradicts that. By the way, I didn't give my name. I'm Lisa King. I'm from Emmett County. And I teach 500 students a week, and I'm so tired of hearing this assault on parents. Oh, parents, they need to do this for their kids. Being a parent is hard, and children who live in adversity rely on us, responsible adults, to help them. The only way I can teach children is when they have the services they need, and some of which our amazing health department, thank you for finding ways to get those services to kids. And when people think, oh, we're just going to deny these grants, it's so transparent. I did not want to believe what is happening, and it is so transparent. So in your attempts to defund the health department, which is a bold charge, which denying 100% of grants put before you for renewal or for application is indicative of an attempt to defund the health department. You're hurting kids. And taxpayers, you ought to be angry because guess who ends up paying for the rotten tooth kid who doesn't have a dentist? And that person goes to the ER. That comes out of our tax dollars. So if the attempt is to somehow help our wallets or reduce government, find another victim besides our children.
Thank you. Yes, ma'am.
Courtney Wilbur, Emmett County. First off, there's something about you all are doing this work, and I really appreciate how strong you are. I don't know why you need to write down all the names of people who are speaking right now. That feels really weird to me. I just want to quickly state a reminder of the separation of church and state. As an atheist in this community, my government should not be making decisions based on your religion. I feel very strong about that. It's deeply offensive to me. No, I don't care what is said in Genesis and how that affects tobacco use. I don't care how your religion means that our children shouldn't have access to preventative dental care. It is really important to me that our children in my school and in my communities have just all around healthy bodies, have access to all the knowledge they need, have full bellies because they can't get access to knowledge without full bellies. It is
very important that our children are full and healthy. It's very important that you stop using your religion in this space to control decisions. It's not your place. I'd like to donate the rest of my time to Mary Pittman.
Thank you. Anyone else like to address the board? Yes, sir.
I like to address the board.
Yes.
My name is Greg Bentley. I'm a taxpayer here in Charlevoix County. And I'm actually coming before you to voice my concerns about grant money and how it's affected our community. I come from a family where I have a nephew who's gotten autism from the modern vaccines that are coming out, and a brother who's gotten Guillain-Barré syndrome from a flu shot. So I thought I'd just start with a little bit of history and a couple of quotes from two famous men. And one had said, "For the love of money is the root of all evil, which while some covet after, they have erred from the faith and pierced themselves with many sorrows." There was also another gentleman in the founding of our nation's history. His name was Dr. Benjamin Rush. And Dr. Benjamin Rush was the Surgeon General of the Continental Army. And he was also one of the signatories on the Declaration of Independence. And what he said is that unless we put medical freedom into the Constitution, the time will come when medicine will organize into an undercover dictatorship to restrict the art of healing to one class of men and denying equal privileges to others. You know, that happened over the last 3 years, and most of that was implemented by our local health departments. We had businesses forbidding people from entering without putting on a surgical mask that did not protect from anything. We had businesses restricting patrons that didn't have a vaccine, an experimental shot. That shot was the most lethal injection, most lethal vaccine injection in world history. You can go to the VAERS report system and you'll see it. It is the most toxic, lethal vaccine in world history. And we need to take a stand. We have to stop feeding this machine that's way out of control. We need to defund the health department, like that woman said. Thank you for your time.
Thank you. Anyone else?
I missed my cue when she donated a minute. I had one point I didn't have time for before I wanted to mention. But earlier this summer, you had the superintendent from the Ellsworth Community Schools come before this full board actually and requested that in the future, when considering grants that impact the schools and their students, that the commissioners contact those superintendents to get their input before making decisions on what to do with grants. I said this in my county meeting and I'm saying it again here. I don't know how many of you contacted Mr. Rubin. I understand represents the school in the Antrim and Salona schools, and I believe Mr. Turnbull represents the Otsego schools that would be impacted by the grants that were being considered. I know I contacted. I hope that you did, and if you haven't, I suggest that you start. Thank you.
Anyone else? Yes, ma'am.
Go ahead. Good morning, I'm representing Mr. Bentley. And I'm Jim Kosky. I wasn't sure what I was going to say today, because honestly, I said what I initially felt, it wasn't my first words and logic. Fortunately, I have a whole lot of personal life experience with word salad, all nonsensical arguments made to distract from the fact that the person speaking on simply does not have an valid, intelligent argument. And I was liberating myself back here. So I will let others argue the moral issues with arguments made during the last session if they choose to do so. I am absolutely positive you can guess how I feel about them. Why else would they be arguing? Certainly not because they have one iota to do with the grants being presented, because anybody with any sense knows that they didn't. Instead, I wanted to focus on a couple of things I almost missed in my initial place of finger. First, I find it interesting that one commissioner feels that the residents of this county would dislike the word disrupt and even ask why we would want to disrupt the system.
when he and other commissioners seem to be dedicated solely to doing exactly that, they're on board with every chance they get. There has been clear and consistent communication from residents that are affected by these decisions, that they are increasingly frustrated with that disruption. Second, the very clear position of view of the board members regarding social programs. Specifically worded that way. That they deem to be ineffective rather than an essential important component of any county health department. I asked that the commissioners look at what kind of programs they had expected to take part in when accepting their positions on the Board of Health, but I already know things they already knew. They expected social programs and they expected to disrupt the system that they have a clear bias against. Some commissioners on this board are not now, nor have they been, acting in good faith toward the position they were elected and or assigned to, and they just told us that flat out. Additionally, due to the arguments that have made and language used, there's an unmistakable intent to continue to operate both in bad faith and with seeming malice towards the department they are paid to work against, for as long as they allow to remain on board. So while I'm deeply offended by the ignorance of the last minute discussions, I do have an appreciation for the honesty and clarity so freely given and enforced as to what we can expect to be an ongoing attempt by some commissioners to interfere with the health department's ability to serve and meet the needs of their communities in the future. I think that putting a voice to the writing on the wall is something that needed to be said.
Yes, sir.
My name is Dan Tizron. I live in Charlevoix County. I appreciate that you guys are looking more deeply into the grant process and what the terms are to receive this money. I looked into cooperative agreement awards and grants, and a lot of the terms and conditions aren't even disclosed until you get a notice of award. And you know, I guess the reason that it's such a big deal is because, you know, in early 2020, 2 weeks to slow the spread turned into 3 years of the most tyrannical loss of freedom that I've ever experienced in my life. And I agree, you know, that we want to do what's right for the community, but I don't agree with what happened. I mean, seeing people not able to go into nursing homes or hospitals to visit their loved ones, businesses getting shut down, and forcing kids, you know, and wearing the mask and everything was counterproductive to the health and well-being of the community. And this was largely implemented by the local health department. And so I think that your efforts to provide oversight is a good thing for the community. And I think looking into where this money is coming from and what are the strings that are attached to this money, what are they requiring the health department to do in order to receive this grant money and the cooperative agreement awards that are being applied for. So you guys are doing a good thing, and I think these things need to be reviewed. And not saying that necessarily every grant should be shut down, but we're going to be subjugated by the terms of these agreements. So I appreciate what you're doing by looking further into each of these. Thank you.
Anyone else?
Good morning, my name is Rebecca Otto, and I'm a citizen of Emmett County. And I am here to remind you that you are recipients of grant money at all times. As commissioners of different areas in our community, you have taken money for grants for police forces. You have taken money in your communities for grants for ambulances, for fire trucks, for other things that are in your community. There's nothing wrong with taking grants. You yourselves have proven that because you've been on those decision-making bodies that have taken those monies. There's nothing wrong with oversight, but you have a bunch of constituents here who are ready to be front seat to how democracy works, and you at least owe them the discussion that goes along with oversight and not having those decisions be made outside of this boardroom, and for us to be able to witness how this actually works. So I encourage you to give us that front seat to how this works. My daughter is joining me here today. She is a board member of a local nonprofit, and she is very excited to see the spirited discussion about everything that happens around this governing body, and we'll be coming with me to other board meetings as well. So, I look forward to what transpires during this meeting, following your invitation, Jonathan. It would be really great if everyone was actually doing what you had proposed in that prayer and were, doing your due diligence in a way that is open and honest and viewed in front of the people that are watching, not only here, but online as well.
Anyone else? Going once, going twice. Public comment is closed. Next on our agenda is the review and approval of the minutes from August 10th.
There,
Yeah,
we have no note that we do have a full board here. That's not in here. Cause we do that like at personnel, we just, so it's on record.
yeah,
Nothing against Cindy, just. in case we don't ask
the questions.
just
Yeah,
make a note, we do have full forum here. It's okay, but just. To be in the record,
Yeah, there's
just,
there's nothing,
Not right.
there's nothing wrong with
Yeah.
having it in the minutes. I mean, we could have all 8 here.
yeah. I just know we do that like personnel, we have forum,
Yep.
just to make a note that,
Yep. Okay. Any additions or corrections to the minutes from the last meeting? I'll take a motion to approve the minutes.
Mr. Chairman, we got the motion that we approve the minutes to 16.
I'll second.
Any discussion on the motion? All those in favor say aye.
Hi.
Opposed, nay. Motion carries. Okay, next we have grant review policy. Dan?
Thank you, Commissioner Rubin. So I guess just a quick recap of last time we looked over this review policy. So we did have a meeting, which looked over the draft of July 9th. And I think there was unanimous support for that and went to the full board. In between, Commissioner Rubin, you had taken another look at it and had some edits that you brought up at that August 1st meeting, and then I think it was decided to bring it back to the committee for a fresh look and just kind of the debate, the differences and try to come away with something that we can all live with. Looking at some of the things that you proposed, Commissioner Rubin, as far as, I think that, the biggest thing, the hardest thing for us, in the original draft from July 9th, and I do have a new draft, which is in your packet, and I apologize for not getting this to you sooner, but there was only just a few minor changes, just some wording things. But the main thing, which is, still holds true from the July 9th version of the policy, is to basically define potential future grants as something that would result in a new program. And I know that's a point of difference, and that's okay, we can discuss that. Some of the issues, when I think about renewal of existing program grants, so we have about 70 that are up for renewal right now. I mean, it's happening right now. We've been working on our budget. We have a Board of Health meeting September 5th when our budget is going to be rolled out. I think September 18th is the date that we have our final budget meeting. So, I mean, all those things are in play right now. And when I look at, if we were going to look at existing grants as part of this policy, some of the problems with that are just the sheer logistics behind it. I figured if, on average, if we had 2.5 hours into preparing the review form and everything. And staff time, you know, I'm looking at about 175 hours of staff time. I'm looking at, you know, if we have 70 grants, if we, just, you know, hypothetically, if we consider, you know, looking at 2 grants per meeting, pulling together program and evaluation meeting, that's 35 meetings, right? Which, you know, we would have to do that within a couple of months, right? Because it would be towards the end of that cycle, and, you know, we don't want to do it too close to the deadline, because we're trying to budget, and, you know, we spend half the year budgeting for the next year. You know how that works, you know, at the county level. So those are some of the, you know, when I look at that, my concerns, and I realize, totally get that at the county level, things are done differently. I think it's not apples to apples though, because there are much fewer grants, at the county level. Commissioner Ruby and I had this discussion. You know, for instance, like in Antrim County, less than 1% of their budget is comprised of grants. Whereas the health department, 73% of our budget is comprised of grants. And I think that is a good thing. I think over, you know, many years ago, prior to any of us in our, you know, roles right now, there was a lot of changes from the state government, from the money that was shared with counties. There was a lot of cutbacks on that. And at that time, we were told to be innovative and seek grants to fill in the gaps, right? Instead of asking for more local appropriations. And that is how we've been able to keep local appropriations low in our budget. It's only 6% of our budget, coming directly from the counties. So I think that's you know, that's a good thing. We are, you know, the health department is a mandated thing that counties have to do. We are in a partnership of 4 counties for this district health department. It is not something that you have an option to do. You have to do it. There are charges in the public health code that says you have to do it a certain way. And there's certain things that you have to do, like prevent disease, prolong life, have organized programs that, you know, help the public health and, you know, prevent disease and help the most vulnerable in our population be the most healthy that they can be. The only way that we can do that is through grants. I mean, that's honestly, that's the only way we can do it. Otherwise, we're going to be, you know, asking for more appropriations, more money from the counties to be able to do those programs. So I guess, you know, looking at, the Board of Health should absolutely, you know, be overseeing, you know, things at the health department, grants. No question about that. I just think the best first step in recognizing that this has not been done right in the past, right? I think the best first step would be to review grants that would result in new programs. And I think that's a good first step. You know, in this policy, you know, and I put right in there that it's intended to provide the Board of Health with oversight of grant funded programs while ensuring the review process is not overly burdensome to HDW staff and program and evaluation committee members. And also in here, you know, put in here that we will, you know, make sure that we have a list compiled that we will share with the Board of Health at the beginning of the fiscal year of all the grants that we have. So there's, you know, full transparency. At any time, you know, Commissioner Ruby and I had this discussion, you know, at any time, if there is something that you want to pull together, you know, you as a member of the Program and Evaluation Committee or any Board of Health member really could say, hey, I want the Program and Evaluation Committee to review this particular program, right? You know, we want to learn more about it. That is within your prerogative to do that. So I guess what I'm saying is I don't think we need to have a big, huge process to look at every single grant. If there's a particular program or grant that you want to dig into further, we're happy to do that. Not hiding anything, happy to talk about our programs and have you consider those at any time. I did take some changes that, Commissioner Rubin, that you did have on, with the steps under procedure about switching around. I think I took it from the first step to the second step, in procedure to talk about like our, vision, mission, strategic plan, and priorities identified community and health improvement plan. I thought that was a good change. And then just define, in the first number one on the procedure, what section 2433 of the public health code is and what the charge is for the health department, given the public health code. Like I said, it is a mandate, all counties have to have a health department. And it's, my job is to move that mandate forward, to work within the confines of that mandate and to provide good public health services for the community as identified through our various community health needs assessments and, what the community needs and wants. And that's, really the gist of it. And, does anybody, I'm assuming that we're gonna have some discussion, but I just wanted to kind of lay that out about, with the changes that I made in this most recent policy and kind of where we were and where we are now.
You got 1, 2, 3, 4, 5 changes, is that right, Dan?
Yeah, it looks like just a few. Some of them are just additions to the sentences or just kind of defining things a little bit. Better and, I also want to say, this was. Like I said, could have been probably handed out sooner and, it's probably more for Jonathan's benefit.
Well, I was just thinking about him because.
Right, and I
you can't see the paper in front of us.
Right, so I'm wondering, just thinking about that too, if I should, read it.
I think
Read
you
the
should.
whole policy, would that be helpful?
Which one are you gonna read right now? Because
The latest draft.
this is the latest draft.
Does it say 828 on the top?
Yeah, well, where's the last one that we had at the last program and evaluation committee meeting that I attended? Did we pretty much agree? That was the final draft.
There's happy, this is the one committee agreed on. Yeah.
Yeah, that's a single page, July 9th. Yeah. Well, right, yeah, right. Well, yeah, I would say give Jonathan a copy because he has a reader that he uses at home, but,
Oh, that's good.
so how would you like, to proceed? Commissioner Turnbull, would you like me to read the newest version? Or
If,
the?
I was going to, if we don't read your, I was gonna request that we take a 5-minute reprieve, and that way I could have somebody read it to me. But by reading it out loud, that way I think it benefits the public, would be the best course of action. Sure, don't mind.
Sure.
Mr. Chairman.
Yeah, okay. So do you want me to read it? Or would you like to?
Let's arm wrestle over it. No, go ahead.
Please.
Okay. All right, so, starts out with, the heading purpose, and this is the grant review policy purpose. On June 6, 2023, the Board of Health passed a motion to give authority to the Program and Evaluation Committee to review potential future grants and give a recommendation to the full Board of Health for approval or denial. The purpose of this policy is to establish a review process for Health Department of Northwest Michigan staff and the Program and Evaluation Committee to follow when potential future grants are being considered. This policy is intended to provide the Board of Health with oversight of grant funded programs while ensuring the review process is not overly burdensome for HDNW staff and Program and Evaluation Committee members. Okay, the next subject heading is policy. Potential future grants are defined as any grant funding opportunity that will result in the establishment of a new program within the health department. Grants for new and existing programs required by Act 368 of 1978, the Michigan Public Health Code, are exempt from this policy. The Board of Health will be provided with a list of current grants at the beginning of each fiscal year for review. The grants list will contain the amount, beginning and end dates, the source of funds, and relevant public health code statute if applicable. The Program and Evaluation Committee will be convened to review potential future grants as needed throughout the year. HD&W staff will prepare the grant application review form to summarize important information regarding the purpose and goals of the grant, along with important financial information. The Program and Evaluation Committee will give a recommendation for approval or denial, which will be considered by the full Board of Health at the next full meeting. Okay, the next subject heading is procedure. Number 1, potential future grant opportunities are reviewed by the division director and health officer or deputy health officer to determine its merits related to section 2433 of the Public Health Code, which is a local health department shall continually and diligently endeavor to prevent disease, prolong life, and promote the public health through organized programs, including prevention and control of environmental health hazards, prevention and control of diseases, prevention and control of health problems of particularly vulnerable population groups, and development of healthcare facilities and health services and health services delivery systems. Number 2, the health officer will request Program and Evaluation Committee recommendation for grant submission. The grant application review form will be completed and submitted within a reasonable time prior to the requested meeting. A description of how the grant fits within the health department's vision, mission, strategic plan, and or priorities identified by the Community Health Improvement Plan will be included in the grant application review form. Program and Evaluation Committee meetings will be scheduled as soon as possible to allow for timely submittal of grant application. A minimum of 2 committee members, a minimum of 2 committee members, not from the same county, must be present. In-person meetings are preferred, but committee members may participate virtually if necessary. If the Program and Evaluation Committee is not able to meet or does not make a recommendation, the grant application review form will be considered by the full Board of Health at the next regular meeting. The Program and Evaluation, this is number 4. The Program and Evaluation Committee recommendation will be added to the agenda for the full Board of Health consideration at the next regular meeting. A motion must be made to accept the committee recommendation regarding the grant application, whether it's affirmative or not. That's it. That's it.
Thank you.
So this one here is developed upon the request from Jairus at the last meeting.
Well, I mean, there were some of the things that I took from Jairus's edits and put in here, not everything to be fair. I still have it as new programs, not renewal of an existing program, and laid out, kind of as I described, because of the sheer numbers that we have, it would just be, I think, logistically impossible really pull that off, especially right now, because we are already, we've wrapped up our budget and we're looking at the budget next week.
Yes, Jonathan.
Yeah, and if I might ask,
Yes, sir.
so yours is, correct me if I'm wrong, but new future grants, and Commissioner Reed's is new and existing.
Correct.
Those are the two lines. Would we be able to, how would you feel about combining them to state pretty much what you said earlier today? New, and you say comma, and existing by request of the Program Evaluation Committee. So like, we still have the new, your part, we have Jairus's, Commissioner Rubin's, the chairman's in there as well, but we combine it with what you mentioned earlier, and you guys are willing to talk to us anytime. If we bring it up, we request it. So maybe put that, maybe just something simple lingo but like that in there.
I've seen it go both ways. I mean, if you make a motion early and then you have to amend it, that kind of gets messy too, so.
Well, I would say that there needs to be, if we're gonna do that, Commissioner Turnbull, I mean, I think there's still needs to be some. What I'm trying to prevent is like a lot of. Staff time reviewing lots and lots of grants and your time. And so how do we come up with that? You know, common ground, I guess. The way I look at it is like, as a Board of Health member, I mean, you can request at any time to have the Program and Evaluation Committee review something, right? And then they go to the full board.
I'm just saying,
I don't know exactly how those.
Say that in here.
I would have to kind of,
Policy.
yeah, I'd have to think about like how to word that, you know.
Cause I
I mean,
was
just like you said, and that's perfect, I like it. And it's just putting it on paper, so.
Just like a statement, basically.
'cause it kind of says there, and the Board of Health will be providing with the list of current grants at the beginning of each fiscal year for review.
Which they did.
Yeah, well, I would,
We had opportunity at that point in time to ask a lot of
yeah,
questions,
I would like that,
you know.
because if it's a fiscal year, we could get a new member a couple months later. That's why I kind of would like it, say, or if,
In January.
yeah, a new commissioner is appointed
At
to,
the first regular.
yeah, to go like we did.
Okay.
I would appreciate that too.
Yeah.
Because that's great.
Because it's like, they would have to wait a whole,
Well, would it be Program and Evaluation Committee first? Or would it be something for the full board?
Yeah, that would be part of January, right?
yeah.
Or
Right.
yeah, or just make it part of
Like the first
orientation,
program, yeah.
the first evaluation or Program and Evaluation Committee, or part of orientation for the full Board of Health. You know, when we have, our first Board of Health meeting of the new year, basically, because you're right, I mean, members can come and go, they change, so we're kind of almost starting from square one at that point.
So it says in here, beginning of each fiscal year, and you're asking for the beginning of the calendar year?
Yeah, because when they, some, if it changes, because I need to be like looking at it.
And John, you just wanted a sentence in here that said. John can't show me on the papers.
Right, the program,
I wrote it on Scott Hankins' pad. Yeah, just something as simple as like existing, or we could say all grants at the request or by all grants as requested by the Board of Health or Board of Health commissioners. So just kind of marrying up what
I don't.
Mr. Dan says with bringing it all kind of together, and putting it on paper. I mean, we know how government is, you can't take anything unless it's in black and white, on paper. So maybe just a simple statements. I don't know if that would be kind of bringing together the two tribes and melding them as one. But I mean, you have your new grants as is stated already in there, no comma, and existing, at the request of a commissioner.
Can I take a stab at it, maybe, or go ahead, go ahead, yeah.
You can say all you want, you can make this 15, 20 pages long. I mean, but this is exactly how government works. We've been working on this since the second month of the year, and here we are. It's almost the end of the 8th month of the year. I left this very meeting 2 months ago thinking that we had agreed on a policy regarding new programs, new grant opportunities to be reviewed by this board. And then I missed the meeting, and then it sounds to me like we're back to square one.
I don't think we're back to square one. We've got.
Well, everybody that was here and was on this committee was agreed to that program that I was last attended 2 months ago, and I expected that one to be brought before the full board for approval. Now here we are working on it all over again, adding this, that, and the other thing, make it more get-go. That's a prime example of how government works. That's why you don't want the government doing anything. I mean,
I hear what you're saying.
we have the right as board members, as commissioners to ask the kind of questions that you're interested in asking one-on-one basis. Say, Dan, how about giving me the time to spend with you in your office? Because I really have a question over this existing grant. We had opportunities at our orientation meeting to ask a lot of questions, and I don't think, we weren't able to get answers to all of them because we'd have been there for a week looking at all those grants. We have that opportunity, we have that right. I don't see why this needs to be that difficult. This is a first step into something that's never been done for this board for years.
Right, but I think what Mr. Turnbull is asking, if he just wants to put that in, just what you just stated, he just wants it written down. That any commissioner may ask to have an existing grant looked at. He wants it in the policy. So I don't think you're that far apart.
Well, I don't see that, if we can do that, there's no reason why we couldn't do that and get it done today. And have something to pass before the board for a vote.
I think that's where we're going.
I don't have any problem stating what is already true.
It's already true. If you want it in writing, yeah, that's.
Yeah.
I would just say, if I would appreciate, I guess, it doesn't matter if a commissioner or board of health member wanted to have a one-on-one conversation or, say, hey, I'd like it if you could bring this to the committee and we just take a look at it, want to learn more about it. We can do it that way too. Either way, if you ask me, I'm not gonna say no, that's what we're here, like I said, we don't have anything to hide, we're transparent. All we're doing is trying to do our jobs.
So the very first sentence. On June 6, 2023, the Board of Health passed a motion to give authority to the Program and Evaluation Committee to review potential future grants. And then Mr. Turnbull proposes and existing grants at the request of a commissioner. A recommendation to the full Board of Health for approval or denial.
Well, we
Can I
can't
put
change
that-
the motion.
Huh?
At first sentence of the motion.
Yeah, that's the I would propose that we put it somewhere else.
Okay,
So in the red, was the added part where I said the Board of Health will be provided a list of current grants in the beginning of each calendar year for review. And then say what that includes. I would just say at the end of that, I would just insert another sentence at the end of that.
Right.
After it says the grant list will contain the amount, beginning and end dates, the source of the funds and relevant public health code statute if applicable. And then I would just say, just put a simple statement there to say at any point, any Board of Health member may, I don't want to say that.
The Program and Evaluation Committee will be convened to review potential future grants as needed throughout the year and or existing.
Well, I would just say, I just kind of wanted to be more specific, say like, any Board of Health member, may ask, for review of any existing grant, that's on that list. Or ask, any Board of Health member may request additional information.
Informational meeting.
what did you want, Jonathan? Did you want review? Or did you want?
I kind of like the direction that Dan's going with that. Request information pertaining to, for review.
How about I say either individually or through the Program and Evaluation Committee?
That sounds good.
We don't want it.
Yeah.
I don't mind sharing information, but we don't need to.
Right.
review that, and that's what they want.
Well, I think what we can do is get to some place where, like I said, we're just stating what. Like I said, if anybody wants to ask us for more information, we will, but I don't want. Like I said, I don't want to review 70 grants, right? That's just. from a logistics standpoint of,
Yeah.
you know what I mean?
So, you know, I don't see why that even needs to be in writing. You know, it's a given as their responsibility as commissioners and part of the board of directors for the health board to do our research and decide if there's something, you know, we got questions, we have the right to ask those questions.
Absolutely.
You know, and that's what's gotten me in trouble is asking questions. All I want is information. I don't have an agenda. You know, and every single member of this commission and the board should know that they have that right to do that. It's not anything you should have to write down. It shouldn't be law. What we asked initially was to have the right to review all new grants. Not, you know, the right to review all existing grants. I don't want to do that. And I think existing grants is asking enough. Or I mean, our new grants is asking enough for that, and that can make life, you know, more than difficult for you as it is. So,
Well, when Dan and I talked earlier, I asked him, I said, how many existing grants is it reasonable to ask to review? Because whether it's 70 or however many it is, how many is reasonable? How many can Shannon put together? Because a bunch of these have never been looked at. And
well, they had it then.
Chance right at the beginning.
Yeah,
huh?
I mean, they were all presented to us right off the beginning. If you want to do deeper dive, go ahead.
So you would rather just put a couple on the agenda for the next meeting?
No, what I'm saying is if you want to do a deeper dive, that's your right to explore. I mean, it's just as though it's my right to ask questions. You know, if I want more information, I go do my own dive.
Well, that's kind of what I was getting at by saying that we would provide a list of the grants. So you are all aware of exactly the information that you need. And then if there's something that you want to pick out of there that you want more information on, I mean, we can provide that information. I mean, that's kind of the idea that I had behind that. It's kind of what we, like you said, what we already did. Probably back in February or March, somewhere in there. Yeah.
Jonathan, did you have, you look like you had something you want to say.
No.
Oh, okay.
It's just interesting. What did they do? What does your employees do, Dan, when they have an existing grant that comes up for renewal? Do they have to fill out all the same paperwork and submit all the same stuff, or is that much more streamlined and it's just like a renewal form?
It's really much more streamlined. We have a system that's through, most of our grants are through the state. You know, most of them are through either Eagle, MDARD, or NDHHS. And we have this system called eGrams, which is an online system, and they ask for, we have to submit reporting quarterly. We have to present them with a budget. Shannon, you know much more about this than I do.
We have to provide a budget on the front end before they will even consider us for a grant, even if it's a renewal. And then quarterly, as Dan mentioned, we are required to provide quarterly reports, how much of the funding has been spent, what it has been spent on. Annually, and that's in addition to the quarterly reports, annually, we have to provide the annual report as well, showing how much we had spent, where we're at, what we intend to do going forward, if this grant will continue. And again, that starts the process for that budget for the next cycle. So it's all done electronically through eGrams, but trust me, if we miss a deadline, they're calling saying, hey, you didn't get your deadline, like, where is this? Are you intending to, submit a grant for this or something like that? Or if we miss a reporting deadline, they call about that too,
So the budget for grants, what's involved in that?
So that's preparing what the grant will be paying for. Is it going to be salaries, supplies, all those budget line items that we go over in the budget? We're about to go over next week. Salaries, communication, supplies, travel, that other category that we're breaking out a little more now. We have to say, here's how we're going to spend those dollars. If there's a match component, we also have to include how we will match those dollars and how we'll be able to do that. What we'll be matching with, is it an in-kind match, is it a funding match? If so, what's the source of it? You can't double up on funding. You can't be applying for a grant that has come down through the federal government to the state, and the state's giving it to us, and then we say, oh, by the way, we're gonna use this federal pot over here to match this grant. It's not allowed. So they're also checking to be sure that we're not doubling up into things like that.
Mhm. And what percentage of them roughly match and what percentage match? Is there a common percentage?
I couldn't tell you off the top of my head.
Okay.
I can back to you. It's a fair amount. I mean, it's not like it's just one or two. It's much more now, but I don't know.
Kind of goes along with, you know, the cost sharing dollars between the state and local governments, in the public health code. You know, how it's supposed to be 50-50, and that's why we get local appropriations from each county. Is, you know, some of those are used in that manner.
For matching.
Right, yeah, for the state funds that are coming in. It's not as, it's fairly, the complexities with public health financing is, you know, right up there. I mean, it's.
It's not easy, straightforward.
No, it's not.
I wish it was.
So the state recently increased their share to 50-50, is that what I heard, or?
Yeah, so just for the, there's 8 programs, that are called ELFS, that's the acronym, Central Local Public Health Services. And statewide, they increased that funding by 25 million, which was supposed to bring what's mandated in the public health code is 50-50 cost sharing. So the locals, you know, are paying 50, you know, half, and the state's paying half. So that bump in funding is supposed to get us to that 50-50. And it's supposed to be.
And when does that start?
This fiscal year, so October 1st. Although we don't know, we probably won't even know by October 1st what that amount is gonna be. Because they have formulas that they use based on population, and we had a new census, and like, you know, for instance, for Eagle, like the permits, how many permits we've issued, like all that kind of stuff. So there's a formula, every health department will get a different amount based on those factors, population, activity, you know, things of that nature.
Do you know roughly how many grants were given, say during COVID, and that are no longer doing anymore? I mean, I know there were grants that came in for the shots and masking and stuff like that. Do you know what's the status on those? I mean, we have a lot of constituents that are concerned about those issues.
There was no grant for masking. I mean, there was immunization money because we had to put together mass vaccination clinics. So that's where the majority of the funding, you know, came in, but Shannon could probably speak better to where those, you know, where those are at, or the funds from that. I mean, we definitely are seeing all that. All that is, you know, either gone away or going away.
Yeah, I was just curious where we are on that timetable with some of those.
Dan pretty much summed it up. It's going away. As I'm comparing 24, and we're gonna learn about this next week. They're all rolling off. If they haven't rolled off already, which a number of them have, they ended in 23. The rest of them are rolling off in 24. So we're winding down big time right now. We'll see it next week.
So back to the policy regarding grants. Regarding grants. This one right here from July 9th, in my mind, is as simple as you're gonna get. And And it says everything that it needs to say. Does it? Does it answer all the questions for every single one of us? Probably not. But I don't see the need to really to carry this on any longer than it really needs to do.
This one that you gave us today, you did this yesterday or today, Dan, or?
I did it yesterday.
Yesterday.
Yes, sir.
I think it's good to have that, a couple things that you have in there about which sections of the health code. I mean, Mr. Mapes is correct that the other one's a little shorter, but, having these things in here is, I feel is helpful. I know we have one change from Mr. Chamberlain on that one to change fiscal to calendar year under policy. And then did we come up with a consensus on Mr. Turnbull adding a sentence about any existing grant may be brought to the board? I mean, we know it's the case, but there's gonna be new county commissioners in the future. So having it in here, I don't feel is it's a bad idea. I think it's good to have it in here.
It kind of already states in here, if we put this in the calendar year, that's when we always get, if we get new commissioners. Yeah.
I think listing it in a sentence like Dan had read to us, I think that's a good idea. You had that under policy, correct, Dan?
Yes.
Oh, I'm just, I'm trying to let you debate amongst yourself, I guess, but.
All right, I'm fine with the red that you added, that you wrote in there, that you pretty much added to the draft of July 9th.
So the one that says October, keep on
The Board of Health will be provided,
the timeline here.
in the policy,
The one that's,
paragraph, the Board of Health will be provided with a list of current grants at the beginning of each fiscal year for review. The grants list will contain the amount, beginning and end dates, the source of the funds, relevant public health code statute if applicable. And then the purpose is to particularly provide the Board of Health with oversight of grant funded programs while ensuring the review process is not overly burdensome to HDMW staff. I'm fine with that. Under procedure, the red, I'm fine with that as well. Because basically that's just giving us the opportunity to review new grants and upcoming grants versus existing. I'm fine with the new grant review kind of a thing. I am not with this thing. So I've read this draft and I can agree with it.
Don, are you okay with adding a sentence under policy that says something like Mr. Turnbull asked about any board member may ask to review a specific existing grant?
I think we have that right already. I don't think that.
We do have that right already.
Yeah,
It's just
and
writing
so
it down
why-
so that it's there.
can I read something that may work, that's, that we get add in there?
Yeah.
As far as the sentence goes, so right after that read, well, I'll just read it for Commissioner Turnbull's benefit. The Board of Health will be provided with a list of current grants at the beginning of each calendar year for review. The grants list will contain the amount, beginning and end dates, the source of the funds, and relevant public health code statute if applicable. This list, this is a new sentence, okay, this is what I'm proposing. Or, you know, or just mentioning it to you, and I'll let you decide if it's something that you want or not. This list is meant to facilitate transparency, and any Board of Health member may request additional information regarding individual grants.
I can go along with that. It sounds like it sounds awful familiar.
Can you read that sentence again, please?
Sure. This, do you want me to start from the beginning?
No, just the last sentence first, and then.
This list is meant to facilitate transparency, and any Board of Health member may request additional information regarding individual grants.
One more time, sorry, I'm a little slow at writing.
Where did you,
I have this list is meant to facilitate transparency, and any Board of Health member may
request additional information regarding individual grants.
may request additional information regarding
individual grants.
individual grants. Josh is out writing the order.
Okay, no mistake, we have to
If I
put an
wrote
arrow.
that fast, I wouldn't be able to read it anyway, so I'm fine with it.
Does that encapsulate what you were asking for?
Right, that's a good summary.
So the way I see it is we have two changes to the policy. One is to change fiscal year to calendar year for review. And the other one is to add a sentence at the end of the red, which would say, under policy, which would say, this list is meant to facilitate transparency. And any Board of Health member may request additional information regarding individual grants.
Yes.
Questions, comments? Yeah.
I'll make the motion for.
Yeah.
So I'll make the motion that we approve this process as amended. And pass along to the full Board of Health.
I'll second.
Do you want us, can we be more specific on the wording, do you mind, Commissioner Turnbull? As far as, the draft, dated August 28th, 2023.
That's the one you just read, correct?
Yes.
Yes, so.
The
Yes.
draft, grant review policy dated, 8/28/2023. Just to clarify. Yeah, because we have multiple drafts going on here.
And we had second, right? Don, did you
Yes.
say-
Wait a minute, can you say it one more time just for the record?
Or should we, how about we write it down?
Yeah, I started to write it down, but I didn't get the
Okay.
specifics. So I move that we approve the. Read again.
To approve the
grant approval
the grant review
Oh,
policy,
Dated.
draft policy, the grant review draft policy dated August 28th, 2023.
As amended.
Yeah.
Thank you. It's a lot to try to remember.
And what about the end of it to the board for consideration?
As amended and recommend to the full board for approval.
For approval.
Okay, I'll read it back to you. Or Melanie, I don't know if you have it. You want me to? Okay. All right. Commissioner Turnbull moves to approve the grant review draft policy dated 8/28/23 as amended and recommends to the full Board of Health for approval. Does that sound okay?
Is that correct?
Okay.
Thank you.
Thank you.
Discussion? I think, it doesn't specifically existing grants, but I think that when there's existing grants that constituents have issues with, they bring them to our attention. We've had it happen a few times already, so I think this is good. Fine. Any other discussion?
Was that seconded?
Yes.
I second.
Oh, okay, all right. Sorry, I just want to, we've had issues with procedure.
Yeah.
It's all right.
Make sure our eyes are dotted.
Yes.
All those in favor say aye.
Aye.
Opposed, nay. Motion carries. All right, and I think that's the last thing on our agenda, so I will call us adjourned at 11:27. Thank you, everyone, for coming.
Thank you.
Yeah.